Well, today the Biden administration says it is putting emergency health personnel on standby in case hospitals become overwhelmed by a COVID winter surge. It is part of the White House's pandemic contingency plan. CBS's Nancy Cordes is there with the new details.
Congratulations on your first dose.
With 90% of the country now seeing a COVID surge, the administration is reinstating its free testing program. Starting today, Americans can order 4 COVID tests per household at covidtests.gov. According to the latest CDC numbers, COVID cases are up nearly 50% in the U.S. in just 1 week. COVID deaths are up nearly 62%.
Why are COVID deaths spiking more dramatically than COVID cases are?
Death numbers are just beginning to rise. We obviously want to make sure that does not go any further. We know we can prevent nearly every death from COVID if people get their updated vaccines and people get treated.
But so far, fewer than 16% of U.S. adults have gotten the new bivalent booster released this fall. Among them, Denise San Miguel in Dallas, who is acting now because her sister got COVID.
I was just scared that I don't want to get it.
Even before this COVID uptick, hospitals were already overcrowded with flu and the respiratory illness RSV. Though on that front, the White House COVID coordinator says there is a bit of good news.
There's still places that have very high levels of RSV. But nationally, there's no question in my mind RSV is heading down.
The White House has been warning for months that its COVID operation is running out of money, and it's asked Congress for another $9 billion. But Republicans are pushing back. They argue the government has already spent too much on COVID. They say if the White House needs more funds, it should repurpose them from somewhere else. Norah?
Nancy Cordes, thanks so much.